guest is here, Dr. Maxwell Adeyemi. He is... Are you hearing me? Yes. Good. Dr. Maxwell Adeyemi is here with us for People Helping People segment. We are going to talk about family medicine. Oh, actually, we're going to talk about diabetics and diabetes more so. He is a family medicine specialist doctor and diabetology. Correct? Good morning, Dr. Maxwell.
Good morning. How are you?
I am good, and welcome to Holding On to Positive Expectations. It is so good having you here this morning, even after we celebrated or we recognized more so Diabetes Day on Friday gone. All right, so based on my research, right, diabetes is a defect in the body, more so is a defect in the body's ability to convert glucose to energy, right? Glucose is the main source of fuel to our body.
Yeah.
When food is digested, it is changed into fats, proteins, carbohydrates. Foods that affect blood sugars are called carbohydrates. Right? And carbohydrates are like bread, rice, pastas, potatoes, and so forth. But this is a dictionary definition.
Right.
We want to break it down. We want to talk about it in lay terms. We want to understand it. We want to know if it's preventable. We want to help someone, because diabetes it's very prominent.
Yeah.
So I want to firstly ask, of course, how does it happen? Explain it to me in lay terms, of course.
Okay. Basically, to function, to function, you need energy.
Right.
And there's a particular cell or organelle in the body that manufactures energy from the food that we eat. That cell or organelle is called the mitochondria. They are inside the cell. They convert the food that you eat into usable energy. Now, so for the food that you eat to then become usable energy, which we call fuel, that has to be digested and then go into the cell. So if you eat carbohydrates or protein or fat or whatever, that would now be converted into usable source. Especially glucose, which directly affects, energy production. What is done is that when you eat maybe your bread or your pasta, like you said, in terms of the carbohydrate,
yes,
that will be broken down into glucose. And the glucose would now have to enter into the cell, and the cell will now utilize that for fuel.
All right. So
to enter into the cell, you need insulin, which is like a lock, a lock opener. It opens the cell like a membrane of the cell and allow the glucose to go in there. And when the glucose gets into the cell, it goes into the mitochondria, which generates the energy. You develop diabetes if the insulin that opens the key into the cell for the glucose to enter is absent, not enough, or dysfunctional. So
tell me, what could make it absent firstly?
Okay.
And then tell me what could make it not enough. And what was the third one you said?
If it is dysfunctional.
Dysfunctional.
Right.
Right? So tell me those three things. Okay. What can make it?
Now, the ones that are absent is either as a result of genetic abnormality or destruction of the beta cells of the pancreas, which produces this insulin. Okay, so that could be inherited genetically. Okay, and that is what gives rise to what we know generally as type 1 diabetes, in which the people have absolutely no insulin. They can't produce it. The cell that produces are all destroyed or they don't function. The other type is if over time you produce less and less insulin as a result of either overwork of the pancreas or some kind of disease entity or problems in the body. So the insulin production decline, or there is destruction of the beta cells, the beta cell mass that produces, so the mass of the cells that produce this insulin reduce over time. That could happen. Or the third one, which is dysfunctional, you may produce abnormal insulin. Sometimes their receptors are deceptive because you have receptors on the insulin that binds, to some of these structures in the body to open the cells. They could be dysfunctional or not efficient in their function, and that will cause the problem.
Okay.
So those ones largely would give you what they call the type 2 type of diabetes.
When it's dysfunctional.
Right.
Okay.
Or you're not producing enough.
So before we get into the types of diabetes, because I know there's type 1, mainly type 1 and type 2, but there are other types.
There are other types, yeah.
Right? What I want to find out, though, is it something that we eat can make this insulin disappear as well, or make it dysfunctional, or make it absent on the whole?
Okay. There are so many things that could make it dysfunctional.
Yeah, tell me about some of those things.
Now, if we're talking dysfunctional and insufficient insulin, now we're dealing more with type 2, right?
All right. So let's deal with type 1.
Okay.
Type 1 is when it's absent.
Type 1 is when you really don't have it. It's not being produced, so you need insulin in your body as a source of treatment for that. So this is common in children. They are born with this kind of genetic abnormality. Okay. And they are, they are born and they're unable to produce the insulin, and they don't have it, and you have to give them to produce.
So is it something you can get through a meal, or is it something that you have to get at the drugstore? What is it?
Oh, the insulin.
The insulin.
No.
I need to understand what it is too, because I do not know. It might sound like why seriously, that's why you asking that? Yeah, I'm asking because I want to most importantly understand, and I want the persons that are listening who may not know or may not be very educated on the topic like I am to understand it.
Okay, insulin is a hormone that is produced in your body. It is produced by the organ called the pancreas.
Right.
So if you don't have it, you don't have it. As a type 1 diabetes who don't produce any, you don't have, you have to be given insulin as a medication. Yes.
You did say that
it's
before.
An injectable form. It's an injection.
Yes.
However, if it is type 2 diabetes, in which some people are not producing enough, or they are producing in a very dysfunctional way or defective way, they are producing some sort of insulin, some amount, but it's not enough. Therefore, there are other treatment, medication, tablets, and other things that can help that situation. That's in type 2.
Right.
But invariably over time, most of them may eventually have to resort to taking insulin after a while, because the body may eventually, be devoid of insulin over time as well. So, when we're talking of type 1, we've talked about that. We're talking of type 2. Then the other type of diabetes is what they call the gestational diabetes, which is triggered by pregnancy. All right, so people who are pregnant are at risk of this, and therefore when they develop it, it has risk for them as well as for their baby. Therefore, it needs to be managed. Most of them may spontaneously resolve after delivery of their baby. Right. However, they also run a 50% chance of developing type 2 diabetes in future if lifestyle interventions are not taken.
Understand. So, ideally, anybody could get diabetes.
Anybody
can get diabetes.
And it doesn't matter if you're young now, or you're
old
or
black,
you're black or white, or you're thin or fat.
Yes.
There are different risk spectrum that you can be exposed to.
Diabetes does not discriminate.
No.
It is just, I don't want to say available, but that's not a good word. But anyhow, you continue. Tell me, so that's the third type of diabetes.
Right. There are other types of diabetes, but for ease of diagnosis, the technical expertise or availability of tests to really differentiate some of the other type of diabetes are not necessarily available locally. We have what they call the MODY type of diabetes, which is the maturity onset diabetes of the youth. You understand? There are about 6 types of that.
Right.
You have MODY type 1, type 2, type 3, type 4, type 5, type 6. Yeah?
Yes.
And then you also have what they call the latent autoimmune diabetes of the adult, which is called LADA. So that's another type of diabetes.
Wow.
Okay? But the major ones we normally deal with is type 1, type 2. Now the majority of people have type 2. Because type 2 constitute about 90% of the total diabetes population most times.
And that's a dysfunction.
That is the dysfunction or the lack of the sufficient production,
insulin,
whatever,
Right.
And that is driven by lifestyle, okay? Driven by lifestyle, obesity, inactivity, okay? What we eat and what we do. And that is where the problem is. Majority of the diabetic population fall in this category.
Okay, so that means Tobago, Trinidad and Tobago.
Trinidad and Tobago, unfortunately, are ranked among the highest incidents in the world as well, per capita or per population. We do have very high incidence of diabetes, okay, because about 15 to 16% of our population are diabetic.
And that is a lifestyle.
That's a lifestyle.
This is the dysfunction with the insulin. So it's triggered by lifestyle traits.
Yes.
What we eat.
What we eat, our lifestyle in terms of how active we are.
Right.
So sedentary lifestyle, obesity, overweight.
So I'm repeating this because I know as Caribbean people, we love sauce. We love fried food. We are Creole.
Yeah.
Right? I love it too, but I use it in moderation, right? And I want us to talk about some of the things that we can eat to more so prevent or balance or, help out the situation with this type 2. Okay. Because the reality is, if you don't get tested, if you don't check it out, well, I want to talk about getting tested out. How can we recognize this in the body? But what I want to say is that if we do not know that it's there, we might be feeding this monster that is within us. And I call diabetes a monster. I call all diseases monsters. We kill ourselves sometimes by what we do, what we eat, what we don't do for that matter, because Dr. Maxwell is now saying that a lack of being inactive. All right. So let's talk about the signs. Let's also talk about how we can figure when it is or where we can go more so to know that we have diabetes. What kind of tests would we have to do? And then let's talk about the food. What do we eat to help balance our lives?
If we start with the symptoms of diabetes, really.
Yes.
Basically, the classic sign, what we always teach about diabetes, you have the 3 classical signs, which is increased urination, increased thirst, and increased appetite. Okay? So you fail to eat more. Even though you're eating, you still feel to eat more. The reason for that is you have high blood sugar in your system, but that blood sugar is not going into the cell to be utilized as energy. So your cell sense that you're hungry, sends information to the brain. There's a part of the brain that is called the satiety center that controls satisfaction.
Right.
Because your cells are continuously hungry, sends information to the brain that you are not satisfied, you don't have enough food in the system.
So you want
stimulate
more.
the brain to ask you to eat.
Yeah.
But your blood is already full of sugar. So that's why we call diabetes suffering in the midst of plenty. It's like you have a big room loaded with groceries, but the door is locked and you are in the living room hungry. You understand?
Yes, I understand.
That is basically what it is.
Yes.
So you need insulin to now open the door of the grocery and say, look, get some food. But that is not happening in diabetes. So the cell is starving, but there's loads of glucose in the blood.
Yes.
So you fail to eat. And because high blood sugar attracts a lot of water out of the cell, you fail very thirsty.
Yes.
So you have the water coming out as urine, so you're passing the urine all the time, and then your system is dry.
Yeah.
And then you feel thirsty.
Thirsty.
So you feel to drink more water, you feel to eat more food, and that's what is happening. Now, glucose is very toxic to your system. So it damages your immune system. Therefore, your ability to manage and control infection is reduced. So people with diabetes have recurrent infection. They get boils, they have fungus infection, they have abscesses. When they get a new wound, it doesn't heal properly. Okay?
Yes.
Good. And then to go further now, you have damages to the nerves in the hands and in the feet and all the blood vessels as well. Therefore, they lose sense of feelings and sensations,
yes.
you know. And therefore, when they get injured, especially on the feet, they may not know.
Wow.
So you could step on a pin or on a nail and you don't know that anything has injured you.
Injured you, wow.
Okay. So they have all that. You have eye problems because you have visual blurring, you have weight loss, you have tiredness and fatigue as a result of lack of energy.
So how can we reverse this? How can we reverse this and make things better in our lives? Even those people might be seeing some of these signs and these symptoms.
The first thing is trying to assess your risk.
Yes.
If you have close relatives that are diabetic, you are at risk. Maybe father, mother, sister, or any of your siblings, you are at risk. If you are a particular race, especially the Asian and the blacks, they are higher risk of diabetes than the whites. If you are above 25, the risk increases as you grow older. Okay, if you have other type of diseases like diabetes and like hypertension, and you're taking certain medications and stuff like that too, you're at risk. People who use steroids as well, because steroids used for either for pain or for medical reasons, for any kind of illnesses, will also increase your risk.
Yes.
Okay, and once you assess your risk, then you need to get tested.
Where can one get tested?
Practically in Tobago, you can get tested practically anywhere, because Tobago has one of the highest in the world in terms of per capita health centers.
Right.
Practically every village in Tobago has an health center.
So go to
if
your
that
health
village
center.
is not there, another 5 minutes away, they have a health center.
Right.
So you can easily go in there and do a simple blood sugar test. We could be a random or a fasting.
Yes.
And then the nurse or the doctor or whoever it is can now advise you, okay, this is what is happening.
Right.
You can go to the drugstores, you can go to your private doctors. There's so many options in Tobago really that you can get tested.
I will be getting tested on Monday.
Good.
Well, tomorrow.
Tomorrow.
Yes. I think this is so interesting. The more you know about something, the more you're prepared to deal with it.
Right.
You know, so even as we're talking about this in this helping people segment on holding on to positive expectations, you might not know, and you might think, well, I'm healthy, I don't do that, I'm active or whatever. But take the time out to get tested. Take the time out to get tested so you can know, right? Be in the know, as they say. Right, so tell us, Dr. Maxwell, tell us some of the foods. So let's say, all right, one gets tested,
Right.
and there is let's say there's a risk, or there's the doctor might say, well, your sugar is, what is said? I don't know. You tell me.
All right, so if you get tested,
Yes.
your sugar might either be normal
Right.
or on the borderline of abnormality or grossly abnormal.
Right. So tell me
Now,
what is normal.
Your blood sugar between, say, 80 and, say, 100 is considered normal.
Mm-hmm.
Let's say between 100 to about, say, 120, or let's say 110, is called pre-diabetes. Pre-diabetes. You ain't diabetic yet, but you're right on the verge.
Right.
Yeah? Anything outside of 1 to 26, which is the cutoff, If it's a fasting blood sugar I'm talking about,
Right.
you're diabetic.
At 126. So
126.
once you're fasting, the fasting is that you had no meals.
No meals for about 8 hours.
Right.
And you get up in the morning and you're going to do your blood test before you eat.
Yes.
If it's above 126, that's the cutoff. So you're diabetic in the fasting blood sugar.
Wow.
Okay. Between that and say about 100 is considered pre-diabetes.
Yes.
Okay, so you have an impaired blood glucose. Okay. You ain't reached the diabetic stage yet, but you are just on the edge. And most people who are pre-diabetic, within 5 to 10 years, about over 50% of them will become diabetic if no lifestyle intervention is made.
Right.
So, once you discover that, then you have to make the necessary adjustment. Usually, when you change your diet, okay, you get active.
Yes.
You are able to actually minimize the risk. Okay. As a matter of fact, most people, once you lose about 7 to 10% of your body weight, you're actually able to either delay or starve of diabetes.
Fantastic. I'll be starting tomorrow. Kian and Mega Vibes, you all hearing this?
Yeah.
So we're going to go jogging after the program.
Not today.
I think this is, it's vital information, very vital information. So tell me, what I also want to do is open the lines right now at 6390791 and 6310219. Right? You can call, you can ask your questions, or you can even share your story on the topic diabetes. All right? Ask whatever questions you want to ask Dr. Maxwell. He will be able to answer it, I'm sure. He is equipped and he is ready to answer any question on the topic of diabetes. All right? Tell me though, you said 100 to 120, that's pre-diabetes, right? So within that period, that's when you change your diet.
Change your lifestyle.
Become
more active, eat less of the high glycemic index food. It's not, as a diabetic, it's not that you can eat any kind of food.
Just in moderation.
It's just in moderation, portion control, portion sizes.
Right. So like if you, every day, you need to balance it every day. So give us like an idea for a meal for one day. And if it can be repeated, or perhaps 1 week if you have that kind of dietary plan.
Really, what we advocate is to have a balanced diet, really, so that whenever you're eating, you take into consideration all the 6 groups of food: the carbohydrate, the protein, the fats, and the minerals, and the fruits and vegetables and stuff like that. Now, what typically happens when we eat is that we pack our food plate with carbohydrates.
Yes,
sometimes people may have up to about 5 different types of carbohydrates on their plate. So you have a dash in here, you've got a potato there, you have rice, and you have a salad that is made of potato, and you have macaroni pie, and you have some dumpling. All of those food are carbohydrates.
Yeah, on one plate.
That
sounds like something Mega Vibes would
have a big jug of juice that is also laden with plenty of sugar. That's another source of carbohydrates. So by the time you say you eat in your lunch, you possibly have about 7-8 sources of carbohydrate.
Wow.
Meanwhile, all you need is one.
Yes.
So when you take in all that calorie, you don't expend them, because overweight and obesity and weight loss weight gain is a function of calorie in and calorie out.
Yes.
So what you put in
is what,
and what you expend, the negative or the positive balance is what determines if you gain or lose weight.
Absolutely. I definitely understand that, and I hope you are understanding that as well. You in your kitchens right now, whilst making that Sunday lunch, you just heard Dr. Maxwell say, because I know we love, as Tobagonians, as Caribbean people, we want to make our macaroni pie. We want to do all sorts of things when Sunday comes. But we really have to balance it off. Make sure you have a fresh salad. Try to avoid the mayonnaise or the potato salads. Even if you do it, if you make a potato salad, Dr. Maxwell, what is a good next thing to, because
moderation is what we preach,
moderation,
right? If you have a problem or issue with dieting and recommend that you see a dietitian or a nutritionist. Normally they will take a comprehensive history about what you like and what you eat and what you can afford or whatever, and then guide you appropriately into how to balance your meal each time you eat.
Right.
So that is why we have them in the system. You've got a lot of nutritionists and dietitians on the island, and they can help you.
Okay. Fantastic. But I'm now even realizing the time is 8:53. And, basically we have to wrap up. I know I said we want to take some calls and whatnot, but we can't take any calls right now. So what I want you to do, if you have any questions, feel free to call Dr. Maxwell himself. His number is 363-1807, or you can visit him at where?
I can just call.
You just call. No problem. So any topic, any questions, on diabetes more so, feel free to give Dr. Maxwell Adeyemi a call. Thank you so much for joining us this morning on Holding On to Positive Expectations.
It's nice to be here.